Hi, I'm Laura Bowman. I'm a physician, pediatrician, and medical acupuncturist here in Atlanta and here at Metro Acupuncture. For almost 20 years, I practiced as a clinical researcher and translational researcher taking care of kids with cancer at St. Jude Children's Research Hospital in Memphis, Tennessee. I came to the interface of Eastern and Western medicine as a skeptic. I had a friend who was a nurse who decided to train as an Oriental physician and got a degree and came back to Memphis and set up an acupuncture and herbal medicine practice. She was among a group of my friends who played cards together, and we used to play cards and debate the merits of Eastern and Western medicine together. Unfortunately, at the time, I was in my 20s and 30s, I had terrible migraines, and she finally convinced me, the skeptic, that perhaps she could help my headaches, which of course I didn't believe. So she treated me, and it helped, and the results were astounding, not just in it helping my headache, but in other ways. And my journey into Eastern medicine began there. The parents of the kids I took care of often arrived with bags of herbs because Western medicine hadn't completely worked to cure their kids' cancer. And I had no problem with that. I just wanted to know what they had and what was in them, so I would consult with my friend about what was in the various herbal medicines that their parents brought. And she would tell me, and I would learn about that in the process. And ultimately, I also sent her some of the children that I had that had chronic pain or other problems which Western medicine wasn't working to solve for them. And so our interplay together then began the first of my East-West interfaces. She also gave me books to read about Eastern medicine, and I loved learning about not just Eastern medicine, but the emerging Western science about why and how Eastern medicine worked at the time. I moved to Atlanta in 2001, and at the time was the director of the bone marrow transplant program at Eggleston, the children's hospital here at Emory, but hadn't been here for very long when I got severely sick myself. My friend traveled from Memphis and treated me while I was in the hospital and also visited with me, but also really urged that I seek help from an acupuncturist here in Atlanta, as I was well enough to do that. So when I was well enough, I sought consultation and care here at Metro Acupuncture from Dr. Kelly. Again, it helped, and again, I was astounded. So as I recovered, I really wanted to be at that East-West interface and help bridge that gap for both adults and children as they sought help for various medical ills. So I trained in acupuncture at the Helms Medical Institute, which is affiliated with the UCLA School of Medicine. And after I was certified, I joined Metro Acupuncture to practice here. I love this practice. It personifies for me the marriage of Eastern and Western medicine, and how I think that interface should work. I love caring for both children and adults. I provide integrative oncology care in our partnership with the Radiotherapy Clinics of Georgia as part of their integrative oncology program, and I treat both women and men who are undergoing radiation treatment. Here at the office, I see both adults and children, but children with a variety of ailments that include migraines, other neurologic diseases, gastrointestinal problems, cancer pain, other kinds of pain, and oftentimes things that aren't diagnosed, that Western medicine hasn't been able to put in a box. I really am passionate about the art of both Eastern and Western medicine, and I'm blessed now to have the time to listen to people and listen to their medical stories, and I like being able to interpret and look at their Western medical results and diagnoses. But I really also like having the vision to look at that with an Eastern eye and another approach to helping them solve their problems and approach their symptoms. Thanks for listening. I look forward to meeting you in person.